you. Thanks to you guys giving up your Saturday morning. So I was talking to myself this morning going, it's really not important that you vote for me. It's important that you relax and that you get this one point that I'd like to make today. It's just one, completely simple. So I want you to think about yesterday. Can you feel that you actually made a difference for someone simply with a smile? Did you make a difference? Truly make a difference? Last week? Last month? Like when you did. What's the feeling that you got when you did? You're all nodding your heads. Like when you did it, right? Well, it's the late 1980s, and I am sitting in the operatory, and I am wide-eyed and I'm amazed, and sweat is dripping from my gloves. As I am nearly assisting for the first time, I'm watching Dale. He insisted that we call him Dale, as he opened a flap for the expanded functions hygienist that I was hired to assist, Betsy. And I started suctioning, if you could call it that. It was like I was in the face. I was like in her way. She wasn't actually able to see anything, but man, I had a first row seat. I was watching this blood spraying, calculus flying, disease demolishing, health generating, open flap SRP. I was completely hooked. You talk about, I was in it. It was magnificent. It was the most glorious thing that I had ever seen in my life. I got to witness this patient, this disease-guttered, low dental IQ, I don't come to my appointments, can't afford it, I'm going to lose my teeth anyway type patient, to a completely 100% periodontally stable patient, no bleeding, no inflammation, fully restored and functional. You talk about making a difference. Like, I was hooked. Off to hygiene school I went. I won't talk to you about the nursing career I started, but so fast forward, I was pushing, I was in the trenches. I was working in those 45-minute appointments where I was trying to make a difference, do everything that we're supposed to do. I was like doing the things that I was trained. I was trying to make those patients healthy, but man, the push became the focus. It was just really this push, and I was really being monitored by the clock like I am now. Like, how do we do this? The clock was ruling, the checklist was ruling, the office manager was ruling, the insurance was ruling. And it became the push. But I ask you to consider that it's really about getting the patients healthy. I know it sounds cliche, making a difference. When people read that on their like, oh, I don't know if I'll show up for this one. Thank you for those of you that did. Because making a difference is my passion. From the moment that I saw that to how I stand here today, it's how I work with practices, it's how I treat my patients, and I live and breathe making a difference. My patients get healthy. I train my teams and my hygienists and my doctors to get their patients healthy. And the head is connected to the body, and it is about time that dentistry take that as a charge. We are the ones that need to be the conduit to put the head on the body and be serious. Because we are the difference makers. And I accept that responsibility. So I want you to think about, in ancient Chinese medicine, the doctor only got paid if the patient was healthy. So if the patient was diseased, sick in any way, not paid, no money coming in. So that little bit of bleeding, that little bit of cavity, that abscess, your paycheck is canceled. How does that feel? If we live from that place and we take health as our charge and we own that, it's not cliche. It's defined. It's not obscure. It's not weak. It's not diluted. When I went back to Dale's office and I worked in that practice, for many years I was blessed. I got to see what true contributing was like, having health as a foundational item in that patient experience, leaving our checklists and our protocols as a framework, not the function of the appointment. Our teams have been checklisted to death and protocoled into paralysis. Now, I am a coach and I love checklists and I love protocols. The gap exists in the application. It exists in that chasm of being able to pivot and be fast on your feet, think with your head, lead with your heart. If my heart is about getting patients healthy, then the destination and the journey are easy. I know. Isn't it breathtakingly beautiful to know that it is so simple? Health. If we stand in that ancient Chinese model of healthy patients pay doctors, stay there. Healthy patients pay doctors. Doctors pay me, so it all works, right? Then why on earth do I leave some of those critical items out of the experience? We've heard lots of people talk about them today. Now it's about filling that gap, getting the training, and getting the people to actually utilize the tools that we've been given or seek them out. Seek out the training to communicate. Seek out the time that you need to effectively treat the patient. Seek out the equipment. If it's time that you need, ask. If it's the intraoral camera, go buy it yourself, for God's sakes. Amen. I mean, you could get some cameras for a couple $100. I mean, come on. If a picture's worth 1,000 words and I have 50 minutes, why would I leave that out? When I talk about intraoral comprehensive photos, it means all the teeth, and it doesn't mean glossy images. In IO pics, we have no filters, and they are not glossy and smooth. Like, that's for Instagram and online dating. Like, I should know. I've used a few, right? I mean, why would you not use your blood pressure cuff? I want you to accept this charge. We are the difference makers. Fill that gap. Fill the void, because you have your checklist and you have your protocol. Now, I ask you and I implore you, if you're checking off your list and you use your protocol and your patient is still not healthy, we have failed immensely. We've talked about a lot of it here today in the last few days: airway, dementia, bedwetting, ADD, that we see it. We see these patients in a perceived state of healthy more than any other healthcare provider. We see disease before other healthcare providers do. And it's now our time to make a difference for these patients. And I know you're sitting in your seat going, but Sarah, why? Why now? Like, I've been this far in my career. I want you to tell the 60-year-old patient that literally has every tooth in her head crowned, that saw her hygienist faithfully for her entire life, every 6 months, like clockwork. She can mark out in time. Those appointments were 30 minutes. She did not know what a health measurement was, did not know how to take care of her teeth, did not know that the contour of her crowns was going to lead to failure, that she is going to lose her teeth. All of her front teeth. The 50-year-old man who was keeping his appointments, he would come in on his self-prescribed on recare every 7 or 8 months because fresh breath was important to him. He didn't keep any other appointment because he was too busy. He was way too busy. but he kept ours. But he had an undiagnosed hypertensive situation, and he had a massive heart attack. Tell his wife you did not have time. Take the charge and make the difference.